Thank you and welcome everyone. Hope everybody's staying warm because I think most of the US is freezing at this point in time. I am in Minnesota, so I guess I'm a little bit used to this weather, but maybe not so much the people in Texas, so I feel for you. Today we're going to talk a little bit about kitties. Sometimes they're not talked about as much as they should be, and we're going to try to change that a little bit here. We want to make them as happy and comfortable as possible, keep them safe. And sometimes it's hard with them because they are experts at hiding some of the things that are going on with them. All animals are, especially cats. It's their natural survival mechanism. And so it's important to pay attention to the little subtleties that they sometimes provide us with body language and facial features. And they may be little ones, but they can be big problem solvers for us too. So the dogs have been getting all the attention, and they deserve a little bit of attention, I think, attention, because they tend to be the ones that are more vocal. Sometimes we think cats as being the easy ones to deal with. They tend to do things on their own where dogs are calling for attention more. And I think it's about time, like I said before, to call attention to the kitty world and put some attention to them, because they've a lot of times veterinary medicine and some of the research projects focus big time on the dogs, but haven't so much in the past, and that is time. It is changing. So how do we know if we're doing good with our kitties? How do we know that we're taking good care of them? Like I said, times are slowly changing, but they're coming more into the spotlight. So research, veterinary care, and recommendations are being a focus, and we are learning and developing more respect to prevention and treatment where cats are concerned. Cats have been considered the easy ones to take care of, but in reality, they may have somewhat independent tendencies, but they need just as much care as dogs do and humans do. So it's important for us to ensure that they're getting the examinations and frequency as much as possible in every stage of the cat's lives. And, you know, the kittens, we know that they need to be brought in right away for their initial vaccines and everything, but it's just as important bringing those cats back in annually, if not more often, because some cats will need to be seen more than just once a year. We need to make sure that we're reaching out to the veterinary healthcare team to make sure that we're doing everything possible to keep these guys happy and healthy and living longer, healthier lives. Exams can include just everything, just like people. It's important to have the heart listened to on a regular basis, eyes, ears, skin, teeth, stomach, and much more paid attention to. And depending on each individual cat, like I said, they may need to come in more often or less often, depending on what the veterinary healthcare teams feel is right for them. Each cat is different. Each stage of life is different. They're individuals. Not every cat is going to be the same or act the same at different age levels. Exams are also important because at certain times we will call attention to lab work, and doing the lab work and doing a bit of hands-on touching and feeling can sometimes keep us up to date and recognize some of the things that might be going inside versus just outside. All cats need vaccines, and I think we know that this is the case. Some states even have mandatory requirements by law, depending on where you live. Usually the core vaccines, and this is what the veterinary healthcare team considers core, is the main vaccines that kitties need. And these are the distemper combination vaccines, which can include 3 to 5 disease or prevent disease, depending on what vaccine it is. And then of course the rabies vaccine. Core vaccines are minimal vaccines that your pet's veterinary healthcare team recommends for your area. And then there's also the non-core. So these may be recommended depending on what is going on in your area at the time, or your cat's lifestyle, or your lifestyle, depending on if your cat goes with you on outings and vacations and everything. It's the exposure factors, what environment they're exposed to. Parasites, we all know that kitties can find critters that we don't want found, and they pose an exposure factor for the kitties. It's important to be proactive in preventing parasites, not only for our kitties' health, but ours as well, our family's health, because some of these parasites can be zoonotic, which means they can be transferred from people to pets, pets to people. They can be easily treated, but it's even cheaper to prevent them. And it keeps our pets happier too because of preventing. Sometimes parasites, if left undetected or not picked up right away, can cause health issues and even some instance death. So we want to make sure that we're staying on top of those things and preventing it if we can. Nutrition plays a big part in health and well-being for every species. Feeding the appropriate diets at the right stages of life is important, and each cat will be different. Like we said in the past, there are things to take into consideration to determine the best diet at each of these stages, and veterinary technicians can and should be helping in these decisions. When we think about how we make decisions for our pets, a lot of times the ads and commercials play into our feelings, and not necessarily the cat or kitty, that it's not speaking directly to them. So we want to make sure when we pick a food that it's the right food, or at least try to get the best food for them, with the best nutrients for them at each stage of life, or for the different issues that they may be having. Think about the education that the veterinary healthcare team brings to the table versus maybe Dr. Google or the 16-year-old in the pet stores that we're talking to. So keep in mind, our veterinary professionals want to help you in the decision making, and always welcome your questions and concerns. So along with nutrition, obesity comes into play. We can deal with this if it happens, but we want to make sure that we're taking into consideration everything that the cat takes in on a daily basis. So your veterinarian or veterinary technician can actually calculate the caloric intake that's needed for each individual cat. Just doing some calculations and helping you and get you pointed in the right direction. If they feel like weight loss needs to happen, then we can work with that too. Make sure you're asking the questions and working with them as a team to help bring the weight down or maintain the kitty's weight. Overfeeding and treating, we don't always consider what we're treating with, and some of these items can significantly impact how many calories come in to the cat on a daily basis. So we want to make sure that we're including and considering all of these things. Obesity can lead to cardiac issues, arthritis, diabetes, and much more. So we want to make sure that we're keeping our cats on a good weight and maintaining a healthy weight. Want to make sure that you consider what you're giving them as far as human food, because some of it can be toxic. So once again, refer to your veterinary professionals, and they will be very happy to help you at any point in time. Providing playtime and the right toys and items will prevent some of the behavior problems typically. So there are toys that are unsafe, which can be ingested. We know strings can be a big one. We've done many foreign body surgeries on kitties that have ingested like yarn and needles and that type of thing. So we want to be conscious about what we're providing them. Scratching posts, climbing trees, safe toys, having them available can prevent behavior problems. And that means keeping them as part of the family and everybody happy at the same time. It's also been determined that cats like to hunt for their food. So providing them with different food puzzles or special treat holders and hiding them, or providing them the opportunity to play with some of these items, can be very beneficial. It keeps the boredom away, and it's more of what they're supposed to be doing in the wild. So it entertains them and, like I said, prevents boredom from coming up. Oops. So litter box, we don't always think that there's a lot to this, but there is. So, and it actually stems for a lot of the behavioral problems and issues that people have in their homes with our furry kitty friends. These days, there's so many options out there for litter boxes and litter, size, whether they're automatic or not, high or low sides, number of cat boxes in the household, placement of the litter boxes, and even the scent and material of the litter. It's all so overwhelming. Keep in mind that you want to have a litter box that's low enough for kittens or high enough, keep in mind the age of the cat, because when they're getting up in their years, they aren't always as nimble as they used to be. So low-sided litter boxes, best for the younger and aging senior cats. Scented litter might smell good to us or better to us, but not always the favorite for our cats. Remember, they like to keep things simple most of the time, so unscented clay litter is usually the one thing that you should start with. Some of the pelleted brands that are unscented are also good options. But once you find something that your cat likes, make sure you stick to it. Changing litter can also provide some issues or pop-up issues along the way too. So best to keep something that's working and keep it around. Teeth can be a real issue. We want to make sure that we're flipping that lip occasionally on a routine basis, even when our cats aren't at the veterinarian. They tend to pop up rather quickly. Cats do accumulate tartar on their teeth quite often, and that's something that they have small teeth, so it comes about. They've got, we don't always think about brushing them, but best practices is to brush them if tolerable. At least get them used to the idea. Teeth can actually so sorry. I'm going to keep talking because all of a sudden my computer decided to do a reboot. I apologize for that. Signs of problems with teeth can come up with different things. There can be drooling, eye watering, pawing at the face. So if you have any question at all, please make sure to reach out to the veterinary professionals at your practice, and they can certainly help with that. No question is going to be stupid to them. They want you to come seek their help with anything that you have questions about. Lab work can be very important too. Like I said, it can be indicators early on of something happening inside the kitty. So along with the exams, it's important to listen to the veterinarian make recommendations as to what is appropriate at that point in time. It can be indicators of kidney disease, liver disease, diabetes, and much more. So making sure that those labs get done at an early age can sometimes help with some of the things and keep them around, keep our kitties around a lot longer. Aging seniors, it is important to pay attention to these guys because they can go downhill rather quickly. They tend to become dehydrated a little bit more. They're a lot less mobile, so providing them with ramps or pay attention to where the food is at so that they can have access to the food and water easily and aren't having to jump onto a counter or something to get to that stuff. I know that sometimes that can be very easily done when we have other pets in our household, that when we're feeding, our cats can be eating on a counter of some sort. But keep in mind that as kitties get older, it's harder for them, so they will hesitate to when this is happening to get up on something, or even not make the attempt. Pain management, we really need to pay attention to this. And I am very sorry that my slides aren't able to be viewed because I was going to provide a feline grimace scale, which it's easy to pay attention to or give a hint as to how they're feeling. So if we notice that kitties' ears are up and eyes are wide open, whiskers are, pretty much centered, that's pretty much indication of no pain or maybe mild pain. But if we see kitties' ears slightly tipped, pulled apart, partially closed eyes, the whiskers are starting to droop, that can be an indicator of mild to moderate pain. If the kitties are squinting their eyes, their ears are rotated outward and dropped, whiskers are drooping down, there's drooling, of course, that's more moderate to severe pain. And if there's any question, like I said, always reach out to help for help from your veterinary healthcare team. They're always ready and able to help you make in those decisions and whether they need to be brought in or not. If it's after hours, I know sometimes it's a question of, well, do they really need to be seen? Because it's not always easy getting them in to see their veterinarian. So there's a lot of different technology coming out there these days. Best thing is to call your veterinary practice that you've been seen or your pet has been seen, and ask what the different options are for them. If it's after hours and you think that maybe they need to be seen, or you have an emergency question type of thing, don't hesitate. There's different applications out there that allow you to talk to a veterinary professional for a discounted rate versus running straight for the emergency practice. and being charged lots of money. Those applications are meant to help you. And if you have any questions as to what those are or what the best ones are, please email me or contact me. I'd be happy to provide you with a couple different options out there. FaceTime is also being done a lot. If you notice something that you're not sure of, snap a picture or a video. This helps your veterinarian and some of the other applications that are out there make a decision in what's going on. Because a lot of times once you get them out of their normal environment and into the practice, they don't do what you saw them doing. So this helps the veterinarian determine some of the treatment options out there too. And we all hope that we are making their lives happy and comfortable as possible, and hope that they live a long, happy, healthy life. Thank you for joining us today, and I apologize once again for my slides. If you have any questions, I'd be happy to answer, or if you feel like you'd rather reach out on a one-to-one basis, I'm happy to do that too. So thank you for attending today, and like I said, keep warm.